while you're enjoying your lunch, I'm going to start a little lunch get-together, whatever you want to call. We're almost done with the meeting. Welcome to everybody. I see a lot of old friends, new faces, new friends, and I hope we get to have a chance to talk and get to know each other. This is what is nice about these meetings. So I am Fernando Kim. Who doesn't know me, I am one of the urologists in the United States, in Denver. Spent my career in Denver. I am also a fellowship trainee in endourology in Baltimore at Hopkins, and I spent all my life trying to develop the minimally invasive urological issues. So while we're here having lunch, I'd like to introduce our faculty, our staff. I'm your host. We have our executive chef, Dr. Cho, who had a great presentation yesterday about semi-live surgery, about this product, DYNE, ureteroscope that has really good characteristics, particular singular characteristics of making our lives easier and better patients' experience and outcomes. I have a sous chef, Dr. Seth Beckes, a friend and a great premier endourologist at UC San Diego, working there with Manoj Monga, also a great friend of mine. And we have one of the young guys interested in wine and alcohol, as any young guy, a great sommelier, Dr. Parikasit, and from Indonesia, fellow, and he will also share some of his thoughts and make sure that we have an enjoyable lunch. Okay, so my job here is to try to present what are the characteristics of a great, safe, and easy, friendly device that could make your life easier as an endourologist treating ureteral stones and stone disease. So what are the things that we're looking for if I had a wish list? I want a high quality optics because I want to see what I'm doing. It makes sense. A wide field of view, and those are pre-requirements. We're now in 2024. We don't have, I saw Dr. Preminger there, one of the pioneers of endourology, hi Glenn, who walked in, and he was one of the pioneers, and he can tell you how crappy was the visualization in the past. We didn't even have flexible scopes. We don't want to see distortion. We want to see things, the stone and the ureteral anatomy, the mucosa, when you're treating the stones. We want to maneuver this easily, and that's what I think the flexibility and also the working channel at 6 o'clock makes this unique scope. The question is, why didn't we think about this before? But thank God we have guys from DYNE that made it possible. And also, you want to steer, you want to maneuver, you want to be flexible, you want to do things that makes your life easier because you're not doing one case. You're going to be doing several cases that day, and you don't want to have fatigue. Durability is important. Of course, it's not a reusable device, but durability is important because you don't want to break like certain scopes that are in the market from other places. Don't have to mention them, but this has a very high quality with elements that makes it very durable, at least for that procedure, with reliable performance. It has to be, like I said, easy to use, with ergonomic design. They're very responsible in trying to create a product that is universal, not for only big hands, like Shaq, for example, or smaller hands, and for the right-handed or left-handed surgeon. And something that is intuitive. If you flex down, you know where the tip of the scope will go. If you try to maneuver left and right, you know always where the working element will be and where the laser fiber or this basket will be at 6 o'clock. And you need to have a safety features that, at least in the United States, we have the FDA. They want to ascertain is biocompatible and inside. But this will places different and the sterility, and particularly after COVID, it makes it a very attractive. You don't have to use to the SPD sterilization process and travel back to surgery, the operating room or surgical center. It very well effective can be exactly packaged. The question is, this is very important, the cost effectiveness. What are the other compared to this one for the same amount of dollar amount of anesthesia medication for that patient, how be ineffective. So all those things are important. Of course, we don't have this device yet. Having a wired with the connection is easy, not heavy, is not cumbersome. A box is very light and very compact, very easy to travel. And all this has to make sense in 2024 for a safe environment. We need to be a little bit green. We need to understand and be responsible about the carbon footprint and the requirements that we can be eco-friendly and make sure that these devices are green. They can be recycled, and we have to be, we ought to be responsible with our environment. So the single-use experience after COVID became must. If there is any medical device company that do not have this to offer to their customers, they're not doing a good service to represent the company and help with the treatment of stones in the patients. Because the patients ultimately are the ones that we want to benefit. So in terms of performance consistency, I believe this is something you need to always keep in mind, and what are the things that you can look for when you see this product in the market. So what is so different and unique about this company and this product is that it allows you to predict always and consistently to see where you're gonna have your auxiliary treatment device, fibers, laser fibers, or basketing, or any other, for example, biopsy forceps for upper urinary tract cancers. You know where the device will exit, and this will decrease your fatigue. You're gonna be more efficient, and this is what I think our kitchen here will be demonstrating soon with our flexible, disposable wish list, and present all this, all the data. So I'd like to introduce Dr. Cho and the rest of the team, and just continue to give the talk while you're enjoying the food. By the way, it's very good. Thank you.